Hello everyone, welcome back to PharmaGyan. As you have already seen in this video, we will start a new topic, that is NSAIDs, that is non-steroidal anti-inflammatory drugs. Now, what are NSAIDs? So, NSAIDs are non-steroidal anti-inflammatory drugs, are non-narcotic and non-opioid analgesics. They have anti-inflammatory, antipyretic activity. They act by inhibiting prostaglandin synthesis. So these drugs are non-narcotic in the sense they are not illegal or non-opioid. It means they are not addictive and also can be taken as over-the-counter drug, that is without prescription we can use these medications. They have anti-inflammatory and antipyretic action. That is, anti-inflammatory means which reduces inflammation such as redness, pain, swelling, and antipyretic means which reduces fever. So this activity is achieved by inhibiting the prostaglandin synthesis, which are the inflammatory mediators. Next we will see the classification. First are non-selective COX inhibitors, which include, so in which first are salicylates. Example is aspirin. Second, para-aminophenol derivatives. Example is paracetamol. Third is propanoic acid derivatives. Example includes ibuprofen, phenoprofen, ketoprofen, and naproxen. Fourth is acetic acid derivatives. Examples ketorolac, tolmetin, indomethacin, sulindac. Fifth are phenamates, which are also called as anthylenic acids. Example mefenamic acid, meclofenamic acid. Next, pyrazoline derivatives. Example phenylbutazone, azapropazone. Last are the oxycams, which are also enolic acid derivatives. Example pyroxicam and tenoxicam. Second are the preferential COX-2 inhibitors, that was only COX inhibitor, and these are the COX-2 inhibitors. Example are diclofenac, aceclofenac, etodolac, meloxicam, etc. Last are the selective COX-2 inhibitors. Example celecoxib and pericoxib. We will see how prostaglandins and leukotrienes are released. So the membrane is made up of phospholipids. In presence of phospholipase 2 enzyme, A2 enzyme, arachidonic acid is released. So further, arachidonic acid in presence of cyclooxygenase is converted into prostaglandins and releases prostaglandins, and in presence of lipooxygenase it releases leukotrienes. So NSAID works by inhibiting the cyclooxygenase enzyme and hence inhibit the release of prostaglandins. Now we will look at the common mechanism of action of NSAIDs. During inflammation, arachidonic acid is liberated from the membrane, as you have already known. Further, the phospholipids is converted to prostaglandins catalyzed by the enzyme cyclooxygenase. It means when the phospholipid in presence of phospholipase is converted into arachidonic acids, further in presence of cyclooxygenase it is converted into prostaglandins. Further, these prostaglandins sensitize the nerve endings to pain caused by other mediators of the inflammation like bradykinin and histamine. So the prostaglandin sensitizes the nerve ending to cause the further pain, which is caused due to the mediators like bradykinin and histamine. Further, NSAIDs inhibit the PG synthesis by inhibiting the enzyme cyclooxygenase. So here NSAIDs work by inhibiting the enzyme cyclooxygenase. This is the primary mechanism of action of NSAIDs, by inhibiting the cyclooxygenase. So remember this thing. If you don't remember the whole mechanism, remember that NSAIDs act by inhibiting the cyclooxygenase enzyme. So that was it for this video. In further video we will see the mechanism of action of individual drug of every group, its pharmacological action, pharmacokinetics, and adverse reaction and also the contraindications. So till then, subscribe to my channel, like this video.